Hello, and welcome to Celiac.com news. Subscribe to our channel to get the latest celiac disease and gluten-free diet news. And if you have any questions, be sure to join the Celiac.com forum online at celiac.com. And now let's move on to the latest Celiac.com news. Celiac disease and nutrient deficiencies: how to restore your health after diagnosis. Celiac disease is an autoimmune condition triggered by gluten, a protein found in wheat, barley, and rye. When someone with celiac disease eats gluten, their immune system mistakenly attacks the lining of the small intestine, damaging tiny, finger-like projections called villi that are responsible for nutrient absorption. This damage means that even those eating balanced diets can become malnourished or develop nutrient deficiencies, sometimes long before diagnosis and sometimes during treatment. Transitioning to a gluten-free diet is essential after diagnosis, but it's just the beginning. Repairing the gut, replenishing depleted nutrients, and restoring overall health are equally critical steps on the road to recovery. In this video, we'll explore the most common nutrient deficiencies linked to celiac disease, especially iron, vitamin B12, and vitamin D, and share practical strategies to help you or someone you love regain optimal health after diagnosis. So, why are nutrient deficiencies so common in celiac disease? The answer lies in the role of the small intestine. This part of the digestive tract is vital for absorbing nutrients. In celiac disease, the immune reaction to gluten leads to inflammation that flattens or destroys the villi. Without healthy villi, many essential nutrients can't be properly absorbed. Specific sections of the small intestine absorb different nutrients. The upper portion, the duodenum, is responsible for iron, calcium, and magnesium. The middle section, the jejunum, handles folate, vitamin B6, and vitamin B1. The lower portion, called the ileum, absorbs vitamin B12, bile salts, and fat-soluble vitamins like A, D, E, and K. Since the duodenum is usually the most damaged area in people with untreated celiac disease, it's no surprise that iron and fat-soluble vitamin deficiencies are especially common, even early in the disease. Let's start with iron deficiency, which is often the first detectable sign of celiac disease. Iron is absorbed primarily in the duodenum. So when this area is damaged, iron from food and supplements can't make it into the bloodstream effectively. This puts people at risk for iron deficiency anemia. Women of reproductive age are especially vulnerable due to menstrual blood loss, and children may experience stunted growth or fatigue. Some common signs of low iron include fatigue, weakness, pale skin, shortness of breath, dizziness, cold hands and feet, and even restless leg syndrome. To restore iron levels, begin with food. Choose gluten-free, iron-rich options like red meat, lentils, spinach, pumpkin seeds, and fortified cereals. To boost absorption, pair these with vitamin C-rich foods like citrus, bell peppers, or strawberries. On the other hand, avoid drinking tea, coffee, or consuming calcium with iron-rich meals, as these can interfere with absorption. In moderate to severe cases, iron supplements may be necessary. Some people with celiac disease tolerate liquid or chelated forms better during the healing process, but always use supplements under a doctor's guidance. Next, let's talk about vitamin B12. Although B12 is absorbed in the ileum, a part of the small intestine that's less affected in early stages of celiac disease, many people with celiac still end up deficient. Why? There are several reasons. Chronic inflammation can interfere with absorption throughout the gut. Some individuals also have atrophic gastritis or pernicious anemia, which reduce intrinsic factor production, a substance needed to absorb B12. And in some cases, changes in the gut microbiome, such as bacterial overgrowth, may consume B12 before your body can absorb it. Symptoms of B12 deficiency can be subtle but serious: tingling or numbness in the hands and feet, brain fog, memory issues, fatigue, mood changes, depression, muscle weakness, or even a swollen, smooth tongue. a condition called glossitis. To replenish B12, include gluten-free sources like eggs, fish, chicken, dairy, and fortified foods. Sublingual B12 supplements, those that dissolve under your tongue, can be helpful if absorption is an issue. In cases of severe deficiency or intrinsic factor problems, B12 injections are often recommended. Even after your levels normalize, it's a good idea to monitor them with regular blood tests to prevent future dips. Vitamin D is another crucial nutrient that's commonly depleted in people with celiac disease. It's a fat-soluble vitamin, and when the small intestine struggles to absorb fats, as it often does in untreated celiac disease, vitamin D absorption suffers too. Plus, many people, especially those in northern climates or who spend little time outdoors, are already at risk. Low vitamin D levels are linked to poor bone health, a weakened immune system, and increased autoimmune activity. Signs of deficiency may include bone pain, frequent fractures, muscle weakness, cramps, fatigue, low mood, especially in the winter, and frequent infections. You can support vitamin D levels by spending 10 to 30 minutes in the midday sun a few times per week, depending on your skin tone and where you live. Food sources include salmon, sardines, eggs, mushrooms exposed to UV light, and fortified plant-based milks. Supplements are often necessary. Vitamin D3 or cholecalciferol is generally more effective than D2. The appropriate dosage depends on your blood test results, so it's important to work with your healthcare provider. Beyond iron, B12, and vitamin D, there are other nutrients to watch after a celiac diagnosis. Calcium may be low due to both poor absorption and secondary lactose intolerance, which can limit dairy intake. Magnesium is another key nutrient, essential for muscle and nerve function, and is often depleted if chronic diarrhea is present. Folate, another B vitamin, is low in many gluten-free processed foods, but it's essential for making red blood cells and especially important during pregnancy. Zinc is another critical mineral for immune health, skin repair, and wound healing. Keeping tabs on these through regular blood testing can help prevent complications down the road. So, what does recovery actually look like after a celiac diagnosis? First and foremost, commit to a strict gluten-free diet. It's the foundation of healing. Even trace amounts of gluten can continue damaging your intestines and blocking nutrient absorption. Be vigilant about hidden sources of gluten in sauces, medications, and foods that may be cross-contaminated. Next, focus on whole, nutrient-dense foods. It's tempting to rely on processed gluten-free substitutes, but they often lack nutritional value. Instead, fill your plate with leafy greens, colorful vegetables, lean proteins like chicken, fish, and legumes, and naturally gluten-free whole grains like quinoa, millet, or buckwheat. Seeds, nuts, and healthy fats are also excellent additions that support both nutrition and gut repair. Working with a registered dietitian who specializes in celiac disease can be incredibly helpful. They can help assess your diet, recommend appropriate supplements, and guide you through the confusing world of gluten-free labels and hidden ingredients. And don't forget about periodic blood work. Ask your provider to regularly check your complete blood count, CBC, ferritin and serum iron, vitamin B12, folate, vitamin D, calcium, magnesium, and zinc. Thyroid function is also important to monitor, especially for women, since autoimmune thyroid disorders are more common in people with celiac disease. Staying on top of your lab values helps you catch potential deficiencies early before symptoms return. If you've recently been diagnosed with celiac disease, or if you're gluten sensitive and still struggling with lingering symptoms, understanding these nutrient deficiencies is key. They can help explain fatigue, brain fog, weakness, and more, and they also provide a clear path toward healing. Even if you don't have full-blown celiac disease, gluten sensitivity can sometimes trigger intestinal inflammation, which may temporarily affect how well you absorb nutrients. In these cases, regular nutrient checks and thoughtful supplementation can make a big difference, especially during stressful times, illness, or diet transitions. In closing, Healing from celiac disease can feel overwhelming at first, but with the right knowledge, support, and medical care, most people can make a full nutritional recovery. It takes time to repair your gut and restore your nutrient stores, but every step you take brings you closer to better energy, stronger immunity, and an improved quality of life. By staying informed and working closely with your healthcare team, you can regain control of your health, one nutrient at a time. To get the latest celiac disease news and information, be sure to subscribe to celiac.com news. Thank you for tuning in and see you next time.